I fear every single day to um, to to be overcome by some kind of sickness, illness, accident that I just don't have any control over.
I regularly see patients who are not taking medications which are vital to their well-being, and they put themselves in great risk by not doing so because they can't afford the prescriptions, even though they're insured, supposedly.
So I think that healthcare reform is very important, not just for the millions of people that are uninsured, but for those of us who are insured and are barely insured and are trying to hang on, but still can't get what we need.
I had to go to that $5,000 deductible from a $2,500 deductible just to keep the rate at the $2,100 a month.
I'm fearful that if there is something wrong, and even if it's something minor, that my health insurance will be raised, or that'll be an excuse for them to discontinue my health insurance. So it's fear. There's a lot of fear.
And now that I've had a life transition, I had a baby, it's like the healthcare industry is punishing me and making me pay more money than I should be paying because it should be already included in what I've been paying into for the last 2 or 3 years.
Very important thing is to pay for screenings, because the screenings are preventive and it's the right thing to do. And when you do the right thing, it always costs less in the long run. If you prevent a calamity, then you don't have to pay for it later on.
You can go from being insured to not being insured or not being insured adequately, in a blink. So it becomes really difficult for, even working people to feel like they can protect their families.
This is crazy. This is crazy that people, they decide, whether to eat or get a potentially life-saving test.
I don't know if I'll be able to hold on for the next 2.5, 3 years to make 65 to collect Medicare. I don't know. But right now I have health care needs, and I'm just hoping that the reform will come, and come soon.
I need to have something so that I can get myself out from underneath. And I'm hoping that somewhere down the line, we will have universal health care.
I take a drug once a week for my psoriasis, and that shot, it costs about $400 each week. So for me to keep taking that drug, I basically have to have insurance, or I couldn't afford it.
But what if we can't afford the premiums? I mean, you figure that we would always, how would we pay?
We haven't gotten there yet. Hopefully it doesn't come to that, but if it does, I'm not sure what I'd do with it.